I'm Noel Castillo. I'm a nephrologist here at the Medical City. The kidneys are the organs in our body that are responsible for cleaning up the blood of the toxins. It is also responsible for maintaining electrolyte and fluid balance in the body. And it is also responsible for secreting an important hormone, erythropoietin, which is actually responsible for synthesizing red blood cells in the bone marrow. One can always have a routine check. There are certain basic laboratory tests that can actually screen our kidneys, particularly the urinalysis and the serum creatinine. The urinalysis will actually give us a clue as to whether the patient might be having some kind of early kidney disease. The serum creatinine is basically the test to gauge or estimate the patient's kidney function. You can also have your blood pressure checked just to make sure that you don't have one of the risk factors for kidney disease. The symptoms in kidney diseases will depend on what stage you are in and also what type of kidney disease you have, because there are a lot of types of kidney disease. A lot of factors can come into play. Like, for example, when you have certain chronic diseases that can harm the kidneys, particularly hypertension and diabetes, that's one. Secondly, if you are taking in some medications that can potentially harm the kidneys, especially the usual pain relievers that we take in, some antibiotics, and even some herbal medications. And thirdly, if we have certain lifestyle peculiarities that can also potentially harm the kidneys. For example, if we're overweight or obese, it can actually affect our kidney health. Based on the data that we have at the Philippine Society of Nephrology, the number one cause of chronic kidney disease is diabetes. This is actually followed by hypertension, and thirdly, chronic glomerulonephritis, which is actually a disease of the glomerulus, which are the filtering units of the kidneys. You can actually screen your urine for any signs of protein spillage. At the early stages of diabetes, you can actually do that by checking for minute amounts of protein in the urine. We actually have tests to detect that. If you already have spillage of protein in the urine, then we can give certain medications that can actually help control it. Both men and women are equally predisposed to develop chronic kidney disease, especially if they have the risk factors. As far as lifestyle choices are concerned, of course, we have to be conscious of our diet, always eating healthy and always keeping our weight in check. We always have to avoid smoking, and we have to be very careful with what we take in with regards to medicines. So we have to always clear with our doctors as to what we are taking in. We should avoid buying over-the-counter pills for whatever reason. Chronic kidney disease is actually a general term for what we call a derangement in the function of the kidneys, or the ability of the kidneys to get rid of the toxins in the blood. The measure for this particular function is called the GFR, or glomerular filtration rate. It's actually the ability of the kidneys to clean the blood of the toxins. So based on the GFR of the patient, we actually label the patient as to stage 1 to stage 5. As far as kidney health is concerned, if you talk about kidney disease, particularly if you go into kidney failure, the lifestyle effect is so huge, and in terms of one's functionality, if you go into kidney failure, you become less functional, you become less productive, that's one. Secondly, the economic impact on not only the patient himself or herself, but also the economic impact on the family is so huge. And of course, the economic impact on the country itself. No, if you talk about dialysis treatment, the amount of PhilHealth reimbursement actually reached almost 3 billion last 2000, the year 2012. No, so it's really huge. No? So one should actually be very careful, not be always concerned with regards taking care of their kidneys. No? Because if one goes into kidney failure, you affect not only yourself but also your family and your countrymen. The good thing about kidney disease is you can actually screen for it. You can try to catch it at the early stage, no, because there's certain stages wherein you can actually try to reverse it or slow down the progression of the chronic kidney disease. No? So it actually pays to be vigilant, no, in terms of screening for chronic kidney disease.